Hi everyone, hope you're doing well. My name is Duncan Goldie and this is Spill the Beans. My guest this week is Owain Hughes. Owain is a medical doctor specialising in ENT and he is a health tech entrepreneur. He's founded two businesses. His most recent venture is Synapsis, and Synapsis you can find out lots more information through listening to Owain for starters, but also through the links in the summary of this podcast as well. Really interesting and really relevant in this sort of, I suppose, crazy world that we're living in at the moment, because it keeps people out of the hospitals essentially and sort of gives them better access to specialists without having to go through a GP consultation and all that kind of stuff in potentially a dangerous environment going into a hospital now. So really good work that they're doing, and they're getting a lot of traction. So I enjoyed it, and I hope you guys do too. Owain, hi, thank you so much for taking the time to chat with me and feature on the podcast. How are you? Tell everyone whereabouts in the world are you right now, seeing as we have people from all over.
Yeah, so I'm in London now. So and I've been in London since the beginning of lockdown, actually. So yeah.
Perfect. How's it going for you?
Yes, better. It's better now than it has been. As we said, we went to a restaurant for the first time on Friday, so that was all novel and exciting.
Yeah, big novelty. Was it everything you expected and more?
Yeah, it was more exciting than I thought it would be, actually. It was a bit like being in on a film set or something. It felt like that. It was a bit, because the waiters were wearing masks, so it was a bit unusual anyway.
Yeah, it's going to take a little bit of getting used to, I think. Yeah.
Yes, exactly.
Perfect. Well, yeah, so obviously I came across your company Synapsis when doing a bit of research in some kind of I suppose companies making waves within the healthcare industry. But I suppose from your perspective, I mean, what kind of led you to found Synapsis? Can you just sort of talk us through the sort of early stages of your career up to this point?
Yeah, sure. So so my background is I'm an ear, nose and throat surgeon. So that's kind of my training. And Synapsis came out of my experience doing that, really. So one of the jobs that I had as a registrar in ENT was to triage or vet referrals coming from GPs. So at that time, it was letters, and we were getting 200 a week into our department. And the reason why I was being asked to do it was they thought that I could, say no to some of them or bat some of them away, so that we had fewer patients to see in the clinic. But from reading the letters, what I realized was that actually, the horse had bolted. By the time I was reading the letter, the GPs already had a discussion with the patient, and the patient's expecting to see a specialist in ENT, and there was very little chance that I had enough information to go off in that letter to reverse that decision. And it would be risky to do that, because who knows what wasn't said in the letter. But what I realized was that actually, if the GP could only ask advice of a consultant there and then, I knew, from my experience and from reading the letters and then seeing the patient, most of the time, all is required is a bit of advice, and sometimes it's just reassurance that actually, yep, you're thinking the right way. Absolutely, I wouldn't do anything else. There's nothing more to do, or maybe it's just yes, and maybe add this test in. And actually, that would answer a good number of referrals and make them unnecessary. And actually, once I looked into it in a lot of detail and reviewed all the literature and not just in the UK but internationally, there's very strong evidence for that. And actually, a good number of referrals, so about 40% of referrals, are unnecessary. And the most cost-effective way of changing that is to give GPs access to advice from a specialist when they're thinking of making a referral. So at that point, once I realized all of that, I became very convinced that actually the health service is going to move in this direction. It's inevitable. It makes so much sense, from a patient perspective, from a GP perspective, from the consultant's perspective, and also, financially for the system, there's so much waste in this gap between primary and secondary care that things will have to change. And, it just became very clear to me that it was an inevitability that things were going to change. And I wanted to be part of that and leading it.
You've obviously got that like entrepreneurial spirit when it comes to, wanting to be at the forefront of, research and I suppose leading the way, particularly within the field that you work in from a medical perspective. But when it comes to the technology side, how much information did you have? It seems quite a daunting prospect to build a whole new sort of platform.
Yeah, so luckily I'd done it before. So Synapsis is the second company I started. So I built a platform that did voice analysis on apps, and and that was used by healthcare professionals all over the world. Actually, we sold it from as far afield as Sierra Leone, Australia, US. So I had a good idea about what it took to build a product that would be used by people. And actually, one thing I knew how much work it was and is, but also I was excited because I really enjoy that process of iteration and building a product and user testing and imagining what it could look like. So I was really excited actually to do it again.
Yeah, definitely. So I imagine, the second time around, is it easier? Is it, I suppose it's a different problem that you're trying to solve, right? And, potentially something that you had a little bit more understanding of from a medical perspective. You're solving your own problems, I suppose, from a works perspective. So, was it, how did you go initially?
So it was different. So although our last product was a medical product, it was really, we were selling to end users. So the clinicians would use it with their patients, or patients would use it themselves. So we had a lot of singers using our product, professional speakers, people that had issues with their voice. So the sales process was different, where here we are selling to systems, to integrated care systems, to trust, to CCGs, and helping them work together and communicate and manage the flow of patients between organizations. So the sales process is very different. The process of building the product is remarkably similar, actually. We have so it's much of it is the same team. We have a kind of an agile approach to the way we work. So it means that regardless of the user case, the approach for development and testing is very similar. So, but the sales process is definitely different.
Yeah, for sure. And I mean, it's still relatively early days, but how has the sort of platform been adopted so far? Is it getting a lot of traction? And in terms of the actual feedback that you're getting from your peers within the clinicians, what's the kind of appetite for it?
Yeah, so it's going really well. So that is the thing I love the most, actually, is getting feedback from people I respect. So clinicians working on the front line. And also, clinicians in leadership positions, and we really saw that during COVID, that they really needed to change the way they work, and they were seeing Synapsis as a way to enable that, to really respond very quickly, and that's very exciting and really gratifying, actually, to have people I respect say good things about Synapsis. So yeah, and ultimately, improving the way patients are experiencing care, not being referred when they don't need to, GPs getting advice there and then, dealing with the patient without the patient having to wait or having to go to the hospital or any of those things, and so that's really, really satisfying. And I guess because of the way where our platform sits, one of the things that we've been working on now is quantifying the value of that to the system and to the NHS, and that's a new element that wasn't there for the previous company. it's, yeah, that's really satisfying, very interesting actually. How do you work that out? And yeah, so the feedback's really good. You know, we're getting a lot of users now. You know, people use it as, you know, a critical bit of infrastructure really for the way, you know, patients are moving between organizations. So yeah, it's very exciting times.
Yeah, for sure. I can imagine. And, you know, I suppose that innovation piece within healthcare that you spoke about at the start of the conversation is something that you'd recognized, you know, fairly early on, that that's the way the industry was going. So it's nice to be a sort of quite a key figure within that. I guess, you know, you kind of touched on it there as well, but around the whole pandemic piece, and, you know, you're providing essentially a solution for that. Do you see this as something that's just kind of a natural progression and potentially an unfortunate way of just kind of highlighting the necessity of I suppose, access to healthcare and digital health? Or is it something that you feel that, you know, you've had to kind of adjust and adapt to as well?
Well, so definitely, you know, if you think back to the middle of March, April, you know, May, what COVID did was raise the stakes. So, you know, the people we were talking to already understood the value that Synapsis could bring in terms of reducing the number of patients needing to come to hospital. In the context of COVID, just raised the stakes, you know, very high, because everybody knew that, you know, there was risks in transferring patients, you know, unnecessarily to a hospital. The risk to the patients, they could infect other people, they could infect staff. So everybody was really focused on solving this problem. And, you know, there was an understanding that Synapsis could do that. So it was a matter of just ramping it up, making it available to more people, more clinicians. So yeah, so COVID did do that, and in the acute phase, but even in the recovery phase, you know, so what's going to happen, or what's the reality now is that capacity, you know, capacity's always been stretched, you know, especially in winter months in the NHS, but even more so now, you know, when you introduce social distancing to A&E waiting rooms, for example, or outpatient waiting rooms, you know, the capacity is just not going to be there, nowhere near what it needs to be unless things change. So, you know, that it's kind of just accelerated what the direction of travel was anyway. You know, there was a direction of travel towards, you know, more smarter ways of working, smarter referrals. This was going to happen. It's just that COVID accelerated all of that.
Yeah, it is you know, we're seeing that kind of across the industry at the moment, it being a sort of slightly unfortunate way of getting to, you know, where we kind of needed to go anyway. So there is some positives to be taken out of it. And I guess, you know, as a sort of more general approach to the wider industry, I mean, both when you were building it and now that you've released it and you're kind of looking at, you know, I suppose a lot of companies having to adapt, and a lot of, I suppose, you know, different types of, you know, access to healthcare and the actual way that healthcare is delivered having to adapt. Are you taking learnings from other businesses, and were you taking learnings from other kind of remote businesses when building the app as well, or the platform, sorry?
Well, so, you know, one of the things that is absolutely key in healthcare is security, you know, cybersecurity. So we keep abreast of what is state of the art across, you know, like other sectors that we looked at is financial sector, for example. You know, there's a huge amount of regulation around data in the financial services. So we worked with companies that specialize in cybersecurity, for example, and information governance, and the changes that came around for GDPR, for example. And so yeah, so we've learned a lot from other industry, what they've done in the financial sector in particular around that. So yeah, and you know, these platforms, so you know, remote, you know, video platforms, you know, telephony platforms, so they're just being adopted at scale across all industries, not just in healthcare. You know, in all sectors, they're seeing a similar kind of change.
Absolutely. And I guess, you know, more in terms of the sort of application of your product as well, when you're, you know, say a patient, for example, and you know, are you still going through the process? I mean, in terms of your future plans, are you still aiming for people to obtain referrals to then use your platform, or would you prefer people to kind of be able to access your platform themselves straight away, knowing where the sort of issue that they have sits and that it applies for that, and then they can kind of book an appointment themselves and cut out the middleman? Or what's the sort of future plans?
So I think the direction of travel really is around shared decision making. So I think that the middleman, if you like, actually I think as a key middleman or middlewoman, actually they're not. I don't think they're that at all. I think they have an absolute essential role and an ever more important role as an advocate for the patient and somebody who can help them navigate and make choices in their best interest. Because it's healthcare is not becoming simpler. It's becoming ever more complicated, ever more specialized. Patients are living longer with more long-term medical conditions. More new treatments are coming on board. So helping patients navigate all of that is very, very complicated, and that's why I think there's going to be more emphasis around shared decision making, empowering the patient to understand, okay, what is the landscape? What are their options? What are the consequences of pursuing this pathway versus that pathway? So I can see there's whether that happens remotely or face to face, whether it happens synchronously or asynchronously. I think this piece around helping the patient, make informed decisions and understanding what the consequences of those decisions are and understanding risk. I think this is going to be a core thing. So I don't think, it's kind of like a consultative bit, whether it's some element of that is automated. I think that there's going to be more and more need for that, actually. Rather than, you wouldn't want, if you imagine like all the services that healthcare could deliver in a vending machine, and all you have to do is put a token, a lot of harm would be done to patients if that was the case. So I think that the role of patient advocacy and shared decision making is going to be key going forward. And what we want to do is to help that process, help smooth that process, and help for patients who want to access certain services that is smooth, and money and time and effort isn't wasted in the bits between organizations. I think that's the real waste.
Yeah, definitely. I mean, I suppose it's going to be really interesting, in over however long it takes for you to do that sort of ongoing analysis of the, specifically how to quantify the amount of time you're saving, the amount of money you're saving the NHS as well. And I think there'll be some really kind of key learnings from that as well. If people did want to kind of keep, I suppose an eye on how you're tracking and be able to access that information, what's the best way for them to do that?
So follow us on all our social channels. So we're active on LinkedIn, Twitter in particular. Come to events that we're organising. So we're putting together some webinars over the summer. So tune into them, or just contact us directly. hello@synapsis.org. We're happy to talk to anyone.
Great. Yeah, perfect. Well, look, I'll let you get on with the important work that you're doing, but it's really exciting to see a kind of now the leader in the innovation of healthcare. So it's kudos to you guys, and keep up the good work. But thank you very much, Owen, for taking the time to chat with me, and I'm sure there'll be lots of conversations off the back of this for people to get in touch, and we'll put all that information that you just described in the summary of the podcast as well.
Fantastic. Thank you very much, Duncan.
No worries. Speak soon. Thank you.
Well, that's it this week then, guys. Hope you enjoyed it. Thanks very much to Owain for taking the time to chat with us and explain all the good work that Synapsis is doing. If you do want to find out more information, obviously, as I mentioned, there's links in the summary of the podcast where you can get in touch with Owain if you wanted to find out a lot more information, or you can just click around on their website. So hope you're well, stay well, and see you next time.